If you've been recently diagnosed with fibromyalgia syndrome, you may be asking yourself, what the heck is a syndrome? Stay tuned as we discuss what fibromyalgia is and is not, and which 6 self-care factors will help you. Fibromyalgia is a common syndrome of chronic, long-lasting, widespread soft tissue pain, accompanied by weakness, fatigue, and sleep disturbances. You may be wondering, what's a syndrome anyway? A syndrome is a set of signs, symptoms, and medical problems. Unlike a disease, which is a medical condition with defined causes and clear signs and symptoms, fibromyalgia has no medically proven cause. With fibromyalgia syndrome, the following 4 major symptoms commonly occur together: anxiety or depression, decreased pain threshold or tender points, incapacitating fatigue, and widespread pain. People with fibromyalgia may also have other symptoms such as trouble sleeping, morning stiffness, headaches, painful menstrual periods, tingling or numbness in the hands and feet, and problems with thinking and memory, known as fibrofog. As you've probably experienced by now, the most common symptom is that of widespread pain. The American College of Rheumatology has established 2 criteria for diagnosing fibromyalgia, namely a history of widespread pain that lasts over 3 months. To be considered widespread, the pain must occur on both sides of your body, above and below the waist. And number 2, the presence of tender points, at least 11 of the 18 predefined sites of your body. Unfortunately, someone suffering from fibromyalgia usually ends up going back to the doctor several times before a proper diagnosis is made. This is because the symptoms are similar to other conditions. To make an accurate diagnosis, your doctor will rely on a comprehensive physical exam and look at your medical history to rule out other conditions and illnesses. There are currently no blood tests to help diagnose fibromyalgia. Your doctor will probably run some specific blood tests to rule out other serious illnesses. As lab tests don't show a physical reason for the pain for your fibromyalgia, this can be frustrating for both you and the doctor. Even though fibromyalgia is referred to as an arthritic condition, it does not cause joint damage or inflammation as arthritis does. It is not a degenerative disease in which the muscles, joints, or nerves are damaged. For example, you'll not lose your ability to walk as a result of the syndrome. However, it is similar to arthritis because it causes severe pain and tiredness, undermining your ability to go about your daily activities. The good news is that fibromyalgia is treatable. Most people with fibromyalgia do get better over time as they incorporate better and better coping strategies into their daily routine. Unfortunately, there is no cure for fibromyalgia, nor is there a single treatment that will address all of your fibromyalgia symptoms. The most effective approach is to use a wide array of traditional and alternative treatments. A good treatment program includes a combination of medication, exercise, diet, and behavioral techniques. Self-care is critical in the management of your fibromyalgia. Here are 6 factors to consider to better manage your particular condition. Number 1 is to reduce stress. Develop a plan to avoid or limit overexertion or emotional stress. Allow yourself time each day to relax. Consider trying stress management techniques such as deep breathing exercises or meditation to help you cope better. Number 2 is get enough sleep. Since fatigue is one of the main symptoms of fibromyalgia, getting sufficient sleep is essential. Establishing a bedtime ritual that is conducive to sleep is helpful, such as going to bed and getting up at the same time each day. Number 3, exercise regularly. Exercising gradually and regularly decreases symptoms over time. Appropriate exercises may include low-impact activities such as walking, swimming, and biking. Stretching, good posture and relaxation exercises, as seen in yoga and Tai Chi, are also helpful. Number 4, pace yourself. Keep your activity on an even level. If you do too much on your good days, you may have more bad days. Number 5, maintain a healthy lifestyle. Eat healthy foods, limit your intake of sugar, fats, alcohol, and caffeine, and try to do something that you find enjoyable and fulfilling every day. And number 6, take your prescribed medications. Be proactive with your medication. Note how they may affect you on a day-to-day basis and discuss any negative side effects with your healthcare provider. There you have it, 6 self-care tips to help you better manage your fibromyalgia. Should you like to learn more about those hands-on treatment options that offer some promise, then visit us at treatingfibromyalgia.com. Just click on the link in the description box below. And don't forget to subscribe if you haven't done so already. Until next time, stay positive, stay strong, stay informed.